We need to start with these hospitalizations that are starting to increase again as this Delta variant takes hold across our country.
This is one of the biggest concerns of the pandemic, having too many people in need of help and just certainly not enough room or enough resources to do so. These are the latest numbers. As of this morning, nearly 1,000 COVID patients were filling hospital beds here in Indiana.
And that number has been climbing quickly over the last week. So tonight at 6, our Jenny Runovich wants to look into the hospitals in one county already running out of room and the struggle that others are now starting to face.
In Tippecanoe County, where COVID cases are up 71%, where Purdue just brought back mandatory masks indoors, the community's hospitals are under serious strain.
Hospitals are struggling at this point.
Our staff and our facilities are stressed and exhausted.
Franciscan Health and IU Health Arnett both max out almost daily.
Our capacity is full and has been for a number of weeks.
It's a perfect storm. More patients, sicker patients, and not enough nurses to care for them.
Yeah, so I've got 4 rooms there and I got 3 rooms here, not staffed.
Franciscan, down 18 nurses right now, had to close its palliative care unit because staffing is so short after a year and a half of nonstop COVID care.
We have staff that are just resigning and saying, look, I can't take this anymore. I can't do this anymore.
Some people are saying, I'm kind of done.
And it's happening just as the highly contagious Delta variant brings in a new wave of COVID patients. Franciscan has a dozen, Arnett nearly 2 dozen. That's double to 4 times the number they had just 6 weeks ago. Many are younger, in their 30s and 40s, and none got the vaccine.
Of the 12 we have this morning, 8 of those were in the ICU and a number of those were on vents. And we've not seen that for quite a while, so now we're seeing sicker patients.
And it's on top of a surge in people with other illnesses, from RSV to heart attacks to COVID complications. It's pushed capacity to the brink.
We've had to go on diversion, which is basically telling EMS, please don't bring us any more ambulances for a period of time. More times in the last 3 months than I've seen in the last 10 years.
We can't transfer people outside of the institution because there's no place to send them to. Many of the hospitals in Indianapolis are full. We even called Crown Point, they were full.
Hospital leaders are now encouraging a return to masks and say vaccination is key to easing this crisis of care.
Please get vaccinated. The impact it has on the community, the impact it has on the hospitals is significant.
Hospital leaders are also concerned for the fall, since last year we didn't see many flu cases. Plus, not all schools are requiring masks this year.
Also tonight, another classroom in Anderson under quarantine as of today. The school district told our partners at the Herald Bulletin a 3rd grade class at Valley Grove Elementary now is among 7 classes that are required to quarantine for the next 10 days. The school still hasn't given an exact count of how many COVID cases they have, but we do know more than 100 students are now impacted by the quarantines after potential exposure there. And expectant moms, tonight doctors are warning you to go out and make sure you get that COVID vaccine.
Especially with the spike that we're seeing in Delta variant cases spreading quickly across the country. Lots of hospitals right now are admitting more unvaccinated pregnant women who've caught COVID.
Julia Kearney, a new mom, understands the hesitation with so many mixed messages that are out there right now. But as an OBGYN working at Community North Hospital here, she says she's seen the data. She trusts the vaccine, and she's encouraging her patients to do the same.
And I'd seen as a doctor what COVID does to pregnant women and the kind of ways that it can go sideways for both mom and baby. So I rolled up my sleeve and got vaccinated.
She did that early in her 2nd trimester, and that's exactly what she's recommending for her patients to do now as well.
Ball State decided today it is not requiring students to get the COVID vaccine, but it is offering a handful of perks if you do. Students who don't get the vaccine have to get a COVID test before arriving on the Muncie campus, then submit to random testing as required. Students on the Ball State campus who get the vaccine are entered into drawings for prizes, things like football game suites and $500 vouchers to tech stores.